Moving right along, as we continue to cope during the coronavirus pandemic, we have Dr. Madad joining the conversation. Dr. Madad, are you there?
I am. Thank you for having me.
Dr. Madad is nationally recognized as a leader and epidemiologist in public health and special pathogen preparedness and response. Dr. Madad was also awarded the prestigious J.V. Irons Award for Science and Excellence. Dr. Madad also appeared on CNN, Netflix, and she was also featured in New York Magazine and the Big Business Insider. It's such a pleasure to have you this morning, Dr. Madad.
Thank you for having me.
Thank you. Dr. Madad, in the global race for this COVID vaccine, Russia has claimed that the Sputnik V vaccine is ready to go. Dr. Madad, could you talk us through this with reliable data?
Well, I think when it comes to any vaccine, the cornerstone is safety and efficacy. And this is why we have a phased approach. You have phase 1, phase 2, phase 3. And each of these phases represents areas that they're essentially covering. There's a lot of when we talk about phase 3, for example, this is really testing the safety and efficacy of a given vaccine in a very large population. Now, with the vaccine that you're hearing from Russia, it seems as if they have not conducted these very large, trials, if you will, and they have cut corners. And as I mentioned, you cannot cut corners when it comes to vaccines. And so another very big aspect of, developing a vaccine is having data, transparent data. So a lot of that is lacking. So I think bottom line, everyone's interested in the bottom line. Should individuals take this vaccine that Russia has now made available? You can't take something that has not been proven to be safe and effective and gone through the normal process, the golden standard process that we have, through years and years of making, if you will. And so here in the United States, as you know, there's a number of different vaccines in various phases of clinical trials, and a number of them in phase 3 going through this very large cohort, if you will, looking at the safety and efficacy, any adverse effects and things like that. And so once that data has been made available, that is when we are able to see how, again, effective this type of vaccine is. And based on the data that we are seeing, at least coming out through the federal government program that we have, Operation Warp Speed, if you will, it does certainly look very promising. But again, we are able to make those final judgments, if you will, once that data has been released.
I totally agree with you, Dr. Madad. We have to follow the science. If we don't follow the science, we could be misled very easily.
That's right. And I think the last point that I'll just quickly make is, vaccine hesitancy is one of the global health threats that we have around the world. When we talk about vaccine hesitancy, this basically is those that either do not want to get vaccinated or want to delay vaccination. And there is, a lot behind vaccine hesitancy. It's not just because they may not understand the science or the medical aspect behind it. It's also the political aspect and the fact that some governments may not be providing transparent information. And so it's very important to educate the public and provide them the resources and education they need to make informed decisions. You're seeing a lot of polls currently being conducted, and the most recent, for example, by the Washington Post and ABC, shows that people of color, they are much more hesitant to get vaccinated because they don't have the proper, education and being informed of what is actually going on. And this is where we want to really make sure we're investing in risk communication and even bringing in leaders from trusted organizations. And the outbreaks that I have responded to, we've always brought in faith leaders, because these are leaders that are able to talk with their community and let them know, what is true, what is false, those aspects together.
Thank you, Dr. Madad. We could always rely on the medical experts like yourself to guide us through these times. And as we continue, there is a summer surge of COVID-19 cases among kids across the country. How concerning is that?
It's very concerning, and this is not something that's unexpected. We absolutely knew that this was going to happen. You know, we obviously sheltered children very early on in this pandemic, and so now as we're seeing schools reopen, as we're seeing more individuals come together, especially in hotspots that already have in terms of, you know, the effect of COVID-19 in children, that's been heavily debated in the media among experts. Bottom line is that children can get infected with COVID-19. They can transmit COVID-19. And in terms of them having a severe outcome, we have instances where, you know, you have this multi-syndrome inflammatory disease. And so a subset can obviously develop that. In terms of overall their impact on the trajectory of this outbreak, certainly I do think that this is something to take lightly. A number of these children, obviously it's not just about the children getting infected, it's also the adults that they're around, the teachers, the other community individuals that they're coming in contact with, and then bringing potentially the virus home to the loved ones. And a number of us live with vulnerable populations or those in the high-risk group. So, you know, what's in the young obviously does not necessarily stay in the young. So it's really important to really take everything with looking at the full picture and the burden of illness. And we really want to make sure that any institution that is deciding to open up needs to follow the various triggers and regulations and various processes that have been laid out by a number of public health officials.
Thank you, Dr. Madad. Could you hold on? We're going to take a quick break and we'll be right back.